Welcome back to CBS This Morning, Saturday. We begin this half hour with a look at one of the communities most at risk during the coronavirus pandemic. Native Americans have long suffered from inadequate health care, and they have higher rates of diseases such as hypertension, diabetes, and heart disease that can make COVID-19 infections even worse. This week, we visited tribes in the West to see how they are struggling to get through this crisis. It's hard to imagine when you look at the vast vistas in the rural West. There's an overcrowding problem here. But there is a problem, and it's big. On tribal lands, even here, social distancing can be hard to do.
I know some of the affected houses out here in Eastern, there's like 13, 14 people that live in that house. So, of course, they're going to get infected. So,
Terry Roberts is purchasing manager on the Wind River Reservation in Wyoming, home to the Eastern Shoshone and the Northern Arapaho tribes.
Housing is limited out here. It took me 6 or 7 years to get to my place. So, and that's after bouncing around from cousin's house to cousin's house,
As Native Americans, we have our sweat lodges that people go into. We do our prayer ceremonies.
Zena Aragon has 7 family members living at her house.
There's a lot of families that are having to live together just for the necessity of paying bills and car payments.
The overcrowded home situation is at least 16 times the national average.
Kevin Alice, CEO of the National Congress of American Indians, says federal funding for housing has been frozen for decades, a violation of old treaties, and now feared as an agent to aid the spread of the virus.
It's a tinderbox for this COVID-19 situation.
We're getting word that the Navajo Nation in southern Utah and northern Arizona is especially hard hit.
Navajo Nation is in the land base is enormous and covers several states. But in their highly populated areas, that's where we're seeing, large cases of confirmed coronavirus infections.
There are more than 1,000 known cases in a place lacking water.
We tell people to wash their hands, but a study showed 30% of the homes on Navajo Nation don't have running water. So how are they going to do that?
$10 billion in federal relief money has been set aside for direct funding to tribes and federal Indian programs. But right now, there's a battle brewing over how the federal government should distribute the money, with Indian groups preparing to take the battle to court.
We're worried that the money won't get right to the tribes.
But time is of the essence.
How dire is the situation in Indian country?
I know our tribal leaders are doing the best they can to keep their communities safe. All the dominoes are in place to fall in a very coordinated fashion if we don't get the attention we need, we don't get the resources we need. That's why this relief funding is so important.
With limited resources, tribal leaders are improvising. The Navajos have instituted strict curfews, requiring people to stay home or face arrest. To keep outsiders out, at an entrance to the Pine Ridge Reservation in South Dakota, we found the Ogallala Sioux tribe's roadblock, one of 9 around the 2 million acre reservation that has the dubious distinction of being the poorest place in America.
All across the state, they need to be trying to test as many people as they can so they know who has it and who doesn't have it.
At Wind River, Dr. Paul Ebert's team has ramped up testing at a higher rate than the entire state of Wyoming. But they face another kind of roadblock. Not everyone has a phone.
A carload of 6 people come in who need to be tested with possible exposure, but none of them had phones.
So getting the results to people infected who tested positive mean they remain out there somewhere. And it's tough. Politics is entering this fray as well, as some of those communities are trying to make sure that everyone gets a bit of that relief money. A special thanks to Walker Dawson, our DJ, who went out there and shot so much of that. It's incredible what they are now dealing with.
It's so important, Michelle, to shed light on it. I know this was so important for you to do. And when you point out that it's become political, we don't have time for that right now for these people. They need the money, they need the help, and even at some really basic levels. Really great report.